I did recognize Chairman Wyden, who was stepped out of the Finance Committee briefly to join us. Thank you, sir.
I thank my colleague, and this is a very good hearing. And particularly, what we're trying to do in the Finance Committee is look at ways for the future to build around some of the things that just are common sense. For example, in the PBM area, we're looking at reducing the role of middlemen. I just came from the Medicare hearing, and these marketing middlemen, based on today's numbers, are taking $6 billion out of the system. $1,300 a patient just on marketing. So I want us to look at the promising models, and that's what Chairman Whitehouse has given us a chance to do today. And I want to explore with all of you, I'll probably start with you, Dr. Caros, chronic care. When I was director of the Gray Panthers, which has now been maybe a year or two ago, as I've been saying, Medicare was an acute care program. It was, you broke your ankle, and then you went to the hospital, and that was Part A of Medicare, and had a horrible case of the flu, you went, saw your doctor, that was Part B of Medicare. That is not Medicare today. Medicare today is overwhelmingly chronic care, cancer and diabetes and heart disease and strokes. And people who have 2 or more of these conditions is now dominating the program. And before he retired, Chairman Hatch worked with us, and Senator Whitehouse remembers this, on a bill to say, we're going to ensure those acute care services are there, but we're going to start building around chronic care. And we passed a transformational chronic care bill, which included the country's first really big investment on the health side in telemedicine in terms of laying out the infrastructure. So we passed it, and one day I was sitting in my office after Chairman Hatch had moved on to other matters, and the Trump administration called and said, how would you feel about our using the telemedicine provisions as the basis for telemedicine services in COVID? And I said, you're asking me how I feel? This is the coolest day I can remember. I've got the administration asking me about something that Democrats and Republicans care about. And that, in fact, was how we delivered COVID-related services to a great extent during the pandemic, is using our telemedicine approach. So if you would, tell us why, because I understand you've been interested in this field, why you think that chronic care coordination and building on these kind of models makes sense.
I think when we look at segments of the patient population that are older with multiple chronic medical illnesses, they certainly have an outsized impact on the total cost of care for the broader population. And I think there's an opportunity to really both control costs and improve patient experience, patient outcomes, efficiency of care. I think what you're alluding to in terms of acute versus chronic illness goes to some extent to the distinction between sort of reactive care models and proactive care models. And I think when you can have a proactive, team-based approach to the care of chronic illnesses, experience is just demonstrating how effective that can be. The timeliness of it is important. When you're proactive, you can often diagnose a problem earlier when the interventions that are required to restore wellness to the patient's condition, it's much more effective when you intervene early. So right care in the right place at the right time is a big piece of chronic illness management. It's also an opportunity, as I alluded to earlier, to incorporate the patient's values and their goals of care. When you have an engagement with a patient with multiple chronic illnesses, a very important part of that is to understand that aspect of their care and give them agency as patients and decision-making power. And often that will actually allow you to avoid unnecessary care or care that the patient never wanted. So I think that those aspects of chronic care delivery are very much incented and facilitated in an ACO model like the Medicare system.
My time is up, and I just wanted to say to you that we'll be back to you because there's really two issues here. One, Senator Whitehouse and I have been very involved in trying to update the Medicare guarantee. You know, Medicare is a guarantee. It's not a voucher. It's not a piece of paper. It's a guarantee. We've done that now, at least made a start with the chronic care additions to Medicare. But I think as we learn more about what the chronic conditions are all about and how to treat them, maybe we're going to learn some things about how to prevent them in the first place. And I'm going to want to talk to you about that relationship as well. Mr. Chairman, good work as always, and your leadership on healthcare is long noted, and look forward to working with you on the things we're talking about today.
Thanks, Chairman Wyden. I have a number of questions that I'll ask Dr. White. That creates a second round. So